Nobody really likes having a chest tube emergency, but they happen. And so I like to create a little chest tube emergency kit to keep at the bedside in case I run into any of these issues. The first emergency you can have is your chest tube falls out, gets pulled, gets dislodged. There are two things you can do about this depending on the hospital that you work at, the provider's preference, as well as the facility's policies on what you should do if a chest tube comes out. First thing you can do is take some sterile 4x4 gauze, place it over the site, but only tape it on 3 sides. This 3-sided tape allows for when the patient exhales for air to escape the chest tube site, and when they take an inhale, that side should come back down and occluding off the site so no air can get into the pleural space. Some places don't recommend doing the 3-sided tape, and instead they recommend doing an occlusive gauze over it. So taking some petroleum gauze, Zeroform gauze, placing it over that site, putting a sterile 4x4 on top of that, and taping it down so the whole site is occluded. I'd also like to mention, if this is happening, definitely be calling for help, and you need to notify the provider right away because you may need to emergently put another chest tube in. Other things I like in the kit are some hemostats, some sterile water or saline, and some alcohol swabs. We rarely clamp chest tubes, but every once in a while you may need a clamp. So I like to have one handy. If your actual chest tube gets disconnected from the drainage system, where the sterile saline or sterile water comes into play is you can take the end of your patient's chest tube and submerge it into some sterile saline or water to create a temporary water seal. Depending on where the chest tube is disconnected at, you may be able to swab both ends with alcohol and reconnect it if that's okay with your hospital's policy. But if your chest tube is dirty, it's on the floor, it's in yucky stuff, you're just going to have to replace the whole thing. So in the meantime, you're creating a temporary water seal with your sterile saline or water, and you can go ahead and grab a whole new atrium and drainage setup. Okay, these are all my little emergency chest tube supplies. Let me know if you have any questions.